You are welcome to the International Herbal Medicine Centre, England. Our topic for this episode: heart attack. A heart attack, also known as a myocardial infarction (MI), occurs when there is a sudden blockage of blood flow to a portion of the heart muscle. This blockage is usually caused by a blood clot that forms in a coronary artery, which is responsible for supplying oxygen and nutrients to the heart muscle. The lack of blood flow results in damage to the heart muscle tissue. The primary cause of most heart attacks is a condition called atherosclerosis, where fatty deposits, plaques, build up on the inner walls of the coronary arteries over time. These plaques can rupture or become inflamed, leading to the formation of blood clots that can obstruct blood flow. Heart attacks, or myocardial infarctions, MIs, can be classified into different types based on their underlying causes and characteristics. The two main types of heart attacks are ST segment elevation, STEMI. This type of heart attack is caused by a complete blockage of a coronary artery, usually due to a blood clot that forms on top of a ruptured plaque. Treatment often involves emergency angioplasty and stent placement to open the blocked artery. Non-street segment elevation, NSTEMI, occurs when there's a partial or temporary blockage of a coronary artery. NSTEMI is typically caused by a blood clot or severe narrowing of an artery. Treatment may involve medications, such as blood thinners and antiplatelet drugs. Unstable angina. This condition involves chest pain or discomfort caused by reduced blood flow to the heart. It's often considered a warning sign that a heart attack may be imminent. Silent heart attack. Sometimes, a heart attack can occur without causing obvious or noticeable symptoms. This is referred to as a silent heart attack. People may only discover they had a heart attack when they undergo medical tests for unrelated issues. Coronary artery spasm. In this case, a coronary artery suddenly contracts or spasms, leading to reduced blood flow to the heart muscle. This can cause chest pain or discomfort, similar to a heart attack. It's also known as variant angina or Prinzmetal's angina. Microvascular disease. This involves damage to the smaller blood vessels in the heart that can lead to chest pain and other symptoms similar to a heart attack. However, it's not typically associated with blockages in the larger coronary arteries. Signs of a heart attack can vary from person to person. They may not always be sudden or severe. When there is an attack, stop all activity, sit or lie down. Rest, wait and stay calm for help to arrive. There are various symptoms which are as follows. Chest tightness. Yes, chest tightness can indeed be a potential symptom of a heart attack. However, it's important to note that not everyone experiences the same set of symptoms during a heart attack. Some individuals, especially women and older adults, might have atypical symptoms or may not experience severe chest pain at all. If you or someone you're with is experiencing symptoms that could be related to a heart attack, it's crucial to seek immediate medical attention. Cold sweat. Yes, cold sweats can be a potential sign of a heart attack. Cold sweats, also known as clammy or diaphoretic skin, can occur as a result of the body's physiological response to stress and pain. During a heart attack, the body's sympathetic nervous system is activated, leading to various physical reactions, including sweating. Heartburn feeling. The sensation of heartburn can sometimes be mistaken for a heart attack, as both conditions can cause discomfort in the chest area. Heartburn is a symptom of gastroesophageal reflux disease, GERD, or acid reflux, where stomach acid flows back into the esophagus, causing a burning sensation in the chest and throat. While heartburn itself is not a sign of a heart attack, the symptoms of heartburn can sometimes mimic those of a heart attack, leading to confusion. Chronic fatigue itself is not typically considered a direct sign of a heart attack. However, extreme and unexplained fatigue can be a symptom of heart disease or other cardiovascular conditions. It's important to differentiate between chronic fatigue and the acute fatigue that might be experienced during a heart attack. Chronic fatigue is a persistent and ongoing feeling of tiredness that does not improve with rest and may interfere with daily activities. It can have numerous causes, including sleep disorders, thyroid problems, anemia, depression, chronic infections, and more. Heart disease or heart-related conditions, such as congestive heart failure, can contribute to chronic fatigue as they may reduce the heart's ability to pump blood effectively and deliver oxygen to the body's tissues. Nausea. Yes, nausea can be a symptom of a heart attack, particularly in combination with other symptoms. During a heart attack, the body's response to reduced blood flow to the heart muscle can lead to a range of symptoms that go beyond just chest pain. Nausea and vomiting are among the possible symptoms that some individuals might experience during a heart attack. Dizziness. Is not uncommon for victim to experience dizzy spell. Yes, dizziness can be a sign of a heart attack, particularly when experienced in conjunction with other symptoms. A heart attack can cause a range of symptoms beyond the more commonly known chest pain, and dizziness is one of these potential symptoms. During a heart attack, reduced blood flow to the heart muscle can affect the heart's ability to pump blood effectively, which can lead to a drop in blood pressure. This drop in blood pressure can result in dizziness or lightheadedness. It's important to recognize that dizziness on its own is not a definitive sign of a heart attack. Many factors can cause dizziness, including dehydration, low blood sugar, inner ear issues, and more. Chest pain. Yes, chest pain is one of the most common and well-known signs of a heart attack. Chest pain or discomfort is often described as a squeezing, pressure, tightness, or heaviness in the chest. It can also sometimes feel like heartburn or indigestion. This chest pain is referred to as angina and occurs when the blood supply to the heart muscle is reduced or blocked, typically due to a blood clot or plaque buildup in the coronary arteries. It's important to note that not all chest pain is related to a heart attack. Other conditions, such as acid reflux, muscle strain, anxiety, or lung issues, can also cause chest pain. Please note that this is an education video. Always consult your medical practitioner for advice. Please remember to subscribe to our channel.